Welcome back to Long COVID Doctor, an educational series for long COVID sufferers. I'm Dr. Tim Robinson, formerly a family doctor, GP for 30 years, now working in Long COVID Services for 5 years. I post on all the usual podcast channels as well as YouTube. I hope you find them helpful, and if you do, please click subscribe to spread the word. So, thanks for all your feedback. Apologies, I just haven't got the time to get around to replying to them all, but I read them and I appreciate them, and please keep them coming because they actually help me with future postings. Another apology, my usual disclaimer. It's important though, obviously, any advice or treatment that I mention during these podcasts and YouTube postings should only be considered after talking to your own doctor. So, this talk is all about eye problems in long COVID, and I will cover the symptoms, what patients are telling us in the clinics that I work for, and the conditions themselves and the causes, and then go on to the treatments and the strategies that can help with those problems. So here we go, an update in eye problems in long COVID. So, eye problems, it has to be said, are not as common as the other long COVID symptoms that I'm sure all of you are experiencing, but nevertheless, they add to the symptom burden of long COVID. They should be taken seriously. Like any new symptom, needs to be assessed, and we've got to know what we're dealing with. So, first thing you must do is obviously talk to your doctor. So, let's talk about the symptoms. What are patients actually experiencing? Well, it could be any number of symptoms. So, the eye, as we know, is a complex sensory organ, and there are many parts to it. So, there's the surface, the external, the outer aspect of the eye, the conjunctiva, and the cornea. The cornea being the sort of, if you like, the see-through bit at the pupil, in which you can look through to the pupil. And then there's the pupil itself that controls the amount of light entering to the eye. And then there's the lens, obviously, that focuses the eye, the rays, the light rays coming into the lens and focuses them on the back of the eye. And the back of the eye is the retina. The retina is where all those photoreceptors, those light receptors are at the back of the eye that create the impulses, the nerve impulses that all feed to the optic nerve, which is present at the back of the eye. And the nerve impulses then travel up the optic nerve or along the base of the skull, and then make their way all the way to the back of the skull, to the occipital cortex, to the visual, the visual area, the eye-seeing area at the back of the skull, as I call it, the visual cortex. So, eye symptoms in long COVID can therefore come from any part of that whole pathway, from the front of the eye, the eyeball, to the back of the head in the occipital lobe of the back of the skull and the brain, where the eye processes all those nerve impulses and creates the images that we see. As I say, long COVID eye symptoms can occur anywhere along that pathway. But when we sort of drill down and look at it in more detail, basically the symptoms come from, if you like, two headings. One is the eyeball itself, and the other is the actual vision. So there are eyeball symptoms and there are visual symptoms. So the eyeball symptoms. So what are patients telling us? So they're telling us things like, my eye feels gritty or irritated or feels hot. They may be complaining of a eye discharge, or they may complain of itchiness of the eyeball itself. Some patients complain of a discomfort or an ache or a pain of the eye, either one eye or two eyes, and they usually describe it as behind the eye. That discomfort may be worse with movement. So those are the symptoms of the eyeball itself. And then let's go on to the symptoms that to do with the vision, what patients are actually seeing. They may describe blurring. They may describe difficulties with focusing. They may describe double vision. They may describe areas of blindness, areas where they can't see in their visual fields. They also may describe flashing lights. They may see these sort of sparks or sort of fireworks going off in their eye. They may complain of sensitivity of light, so hypersensitive to light itself. There may be associated symptoms with those visual symptoms, such as headache or migraine, visual disturbance. There may be nausea. There may be dizziness. So those are the symptoms. That's what our patients are telling us. What are the causes of those symptoms? Well, again, let's break it down into the two headings, the eyeball heading and the vision heading. Okay, so first of all, the eyeball problems. So there may be the residual effect of the acute viral illness, the acute SARS-CoV-2 viral illness that may be affecting the surface of the eye, the conjunctiva, or the and leading, or the cornea, as I was explaining earlier, so leading to conjunctivitis or uveitis or keratitis. And that's probably because of the excessive cytokine inflammation of the acute infection that's caused some superficial surface damage to the eyeball. Another common problem in eyeball problem in long COVID and in general really is dry eye syndrome. And that's due to reduced tear production from the tear duct and the tear gland, the lacrimal gland, which we all have got two, one for each eye. And if the duct is not working properly, or there's swelling of the gland, the actual duct, if the gland's not working properly, or the duct is blocked because of inflammation, then that's going to cause problems. So that could well be, if the gland is malfunctioning, or that could be an effect of the direct effect of the virus that may be harbored in that gland itself, or remnants of that virus, or equally, it may be something to do with the nerve supply to that lacrimal gland that has been interrupted. So therefore, it's a dysautonomic problem. I talk about dysautonomia, of course, at length, and obviously I've done an update on that as well. So that's the actual direct effect on the eyeball itself, the dry eye syndrome, but also the patients are maybe presenting with eyelid problems along the margin itself, over the lid overall, or just the margin, the lining of the eyelid. And that may be part of a mast cell activation that might be happening. Again, that is, as we know, a very common cause of long COVID problems. So again, I've done an update and posted an update on mast cell activation, which I'm sure you may well, or hope you've all listened to or watched. But if there is mast cell activation, then that will cause itching of the eye margin, eyelid itself, like, in hay fever. So again, it's the same process. Release of histamine is causing this from the mast cells, is causing this itchiness of the eyelid, eye margin. So those are the main sort of causes underlying the presentations to do with the eyeball that patients are bringing to us. What about the vision problems? So eye blurring or focus problems. Well, that can be due to a number of different things that are going wrong in the whole long COVID process. It may be due to a problem with the eye muscles themselves that are holding the pupil in place. So and part of the actual pupil itself, the pupil, as we know, either constricts or dilates according to how much light there is coming from outside. So if there's not a lot of light coming through, then the eye pupil dilates. Okay, if there's loads of light coming and on a really bright sunny day, then it will constrict. The dilatation and constriction of the pupil is controlled by the autonomic nervous system. Again, I talked about a minute ago, dysautonomia. So if you've got dysautonomia as a result of your long COVID, again, one of the very common problems occurring in long COVID and responsible for so many symptoms. If you've got dysautonomia, you may well have problems with your pupillary reflex. So that's going to cause problems with light tolerance or focusing and blurring. Then the lens itself. The lens may not be doing what it should do, and that is either becoming nice and thin or nice and fat, according to whether you're looking far or near. And the depth of the eye lens is all controlled by the ciliary muscles. And ciliary muscles, again, are controlled by the autonomic nervous system. And so if there's muscle fatigue, because this, after all, is a muscle, so we know that muscle problems occur in long COVID for all the many reasons. So if you've got muscle fatigue, then you're not going to be able to focus so well. Again, part of the muscle itself or the dysautonomic process again. Another muscle problem is the actual control of what we call the external ocular movements. Okay, so the external ocular movements, being able to look left, right, up, down, near, far, your eyes dodging around, controlled by three what we call cranial nerves. These are three nerves that take their origins from deep inside the brainstem, and they control individual muscles. And so the cranial nerves, that's the third, the fourth, and the sixth cranial nerve, that's the external ocular muscles, the abducens muscle, and also the lateral rectus muscle. They are controlled by those cranial nerves, and those cranial nerves can be affected by a virus. And that brings about something called a mononeuropathy. So a virus, so SARS-CoV-2 virus, could pick out that particular nerve, that particular cranial nerve, and disable it. You can also get mononeuropathy with diabetes. And obviously, in our long COVID assessment, we're looking at whether a patient has become diabetic as a result of the long COVID. But it could be one of the reasons why someone has one of these cranial nerve neuropathies. It could be a diabetes, or it could be the virus itself. Then looking deeper into the eye, we've got retinal arteries and retinal veins. Okay, so as we know in long COVID, the blood becomes sticky, so hypercoagulable, and that leads to microthrombi, microclots, and they can then block off the retinal artery or retinal veins or branches of them. And they've blocked off, therefore that leads to oxygen starvation of that particular branch that was serving the retina. And so therefore that can lead to um, uh, that part of the retina, if you like, being shut down and basically those cells to die because they're starved of oxygen. Well, now we're at the retina, so those cells may die for that reason, or there may be endothelial dysfunction to do with excessive inflammatory processes occurring with the acute viral impact on those tissues. And then finally, we get to the nervous system part of the eye. So the nerve, as I said earlier, all the photoreceptors, all the receptors, the light detecting receptors on the retina, are all, if you like, linked up with the optic nerve. The optic nerve then takes all those impulses along its pathway to the part of the brain at the very back of the brain, as I was explaining, the visual cortex in the occiput. So we know that nerve tissue, nerve fibers, and parts of the brain can be affected by inflammation of the brain's immune system, the microglial cells, the macrophages, and they release cytokines, and so that brings about inflammation. So if there's inflammation and damage in any part of that nerve pathway from the back of the eye to the eye center in the visual cortex, that can cause problems with seeing, with vision. So it's complex. I haven't, of course, mentioned microthrombi that can occur anywhere along that pathway. Again, just another cause for vision problems that result in blurring or focus, or even areas of blindness because of that. And finally, we come back to our old enemies of long COVID, and that is brain fog and fatigue. Those two commonest symptoms of long COVID. These two can cause problems with the vision and lead to blurring and fuzziness and difficulty with focusing. So brain fog, of course, when we're having with brain fog, what is the commonest things that results in? Difficulties with concentrating and holding your attention. So if you're really struggling with that, with reading or watching the TV or a film or what have you, then that can then lead to strain on the eye muscles, and then consequently, bingo, that can lead to visual problems. So that's brain fog. What about fatigue? Well, same thing, really. Remember that the smooth muscles controlled by the autonomic nervous system, the ciliary muscles that control the light coming in and control the size of the pupil, and the pupillary muscle that brings about the control of the lens, the focusing of the lens. So both of those are controlled by smooth muscles, controlled by the autonomic nervous system. Muscles, as we know in long COVID, can get fatigued. They do get fatigued for many, many reasons, but we won't go into those right now. But basically, the fatigue of those muscles bring about malfunction of the ciliary muscle and the pupillary muscle that leads to poor light control, poor focusing, visual problems. So, those are the causes, those are the symptoms. What do we do about these problems if you've got eye problems? Well, any new problem, what do? We go to the doctor. We need a diagnosis. We need guidance. Maybe there's some treatment that the doctor can give very easily. Maybe you're going to need a referral to an eye specialist, an ophthalmologist, to confirm that diagnosis or look deeper into it. Or, the ophthalmologist can request special, more technical tests, investigations. Before this, you've reported, you've attended the doctor because you've got this new eye symptom. What's the doctor going to do? Your GP, your family doctor. Your family doctor is going to take the history. They're going to ask you all about the symptoms, the description. Exactly what are you experiencing? What eye symptom are you experiencing? And they're going to ask you, well, when did it come on? How long has it been there? What makes it better? What makes it worse? Is it continuous or is it intermittent, coming and going? So brain fog and fatigue causing this problem may well just come and go. They'll be asking about any trigger factors that, you've become aware of. They'll probably ask you, or should ask you, any other associated symptoms. So it's all to do with finding everything out, just to be really clear as to what you, the patient, are experiencing. The doctor will hopefully, and I'm sure will, ask for other conditions that you might have or treatments you might be on. So I mentioned earlier, diabetes. That can present with that mononeuropathy. So it's really important that the doctor asks whether you've got diabetes or not. And likewise, blood pressure. Blood pressure problems can lead to sort of hypertension. High blood pressure can lead to damage of arteries. Therefore, it makes you more prone to problems with those blood vessels that are on the surface of the retina, serving the retina itself. And then likewise, heart disease. So if you've got heart disease, it means that you probably have got a bit of atherosclerosis, narrowing of the arteries and furring up of the arteries. And so that's obviously relevant because that predisposes you to visual problems in itself. The doctor may well ask you, or should rather, ask whether you've got any other autonomic problems. So thinking autonomic, I beg your pardon, or autoimmune problems. So other autoimmune conditions that may well be complicating this whole situation, whole picture. Having gone through the history and really got a clear idea as to what is happening to you with regard to your visual symptoms, and then the background with regard to past medical history, etc., then it's on to the examination. Your doctor will obviously want to look on the outside of the eye, first of all, the eyeball itself, look at the conjunctiva for any redness or discharge, look at the cornea, look for a corneal ulcer if there's pain of the eye with blinking particularly. Look at the eyelids, look to see whether they're dry or flaking, red itself along the eye margin. The doctor will shine a light in your eye, look for a pupillary reflex to make sure that the pupil contracts with bright light and then opens and then dilates, opens up again when you take the light away. So checking for that autonomic supply, that autonomic function of the pupillary reaction. The doctor will basically put his finger up and say, follow my finger left and right, up and down, to check for the external ocular movements, i.e. checking the cranial nerves, make sure they're all intact. The doctor will then check for your visual fields, make sure that there are no blind spots anywhere in your whole visual fields, and so they will ask to see whether you can see the finger fluttering left, right, make sure that there's no blank area. And then finally, the doctor should check your visual acuity, to your seeing ability with distance and near sight. So they'll put up the eye chart, the Snellen chart, to make sure that your seeing ability from the left to the right are the same, and to actually mark it down exactly what your seeing ability is, and to make sure to see whether you're short-sighted or long-sighted. So that's the examination that, all doctors will put you through. After that, the next examination is the doctor will use his or her ophthalmoscope, and that looks in the back of the eye. It's the window at the back of the eye to look at the retina, the blood vessels, and the optic nerve itself. So the blood vessels, the doctor will be looking to see whether they look normal, to see where they cross, whether there's any nipping of those points where they cross each other. That in itself can be indicative of high blood pressure. The doctor will be looking for hemorrhages on the back of the eye, the retina, looking for any scarring. The doctor will also look at the optic nerve itself, and to make sure that the edge of it is nice and crisp and not showing any inflammation, which would be a sign of inflammation of the optic nerve itself, optic neuritis. This whole process, of course, and you're familiar with this now, is also part of the whole thorough initial assessment, in which the doctor is checking for red flags. You know what red flags are. Red flags are those symptoms or signs that are suggestive of some underlying medical condition or something that is alarming and more suggestive of something more sinister. So the doctor is always on their lookout for a red flag symptom or a red flag sign. That's examination sign. So what are the red flags for the doctor to be on their guard and on their lookout for? Well, there are a couple of really clear red flags, and the first one is sudden or visual loss, and that could be due to what we call a TIA, transient ischemic attack, or a stroke itself. So if the doctor detects those, the doctor will be wanting to get you to be assessed pretty quickly. New double vision, that could be a sign of one of those cranial nerves that is, for some reason, not functioning, not working normally. And like I said, that could be due to diabetes, or it could be also due to a TIA or a stroke itself. So that's the second red flag. The third red flag are flashing lights. So flashing lights are a red flag for something called vitreous detachment, or more seriously, retinal detachment, where part of the retina comes away from the back of the eye. That's really serious because that's irreversible if it's left for too long. So the doctor will want to refer you straight away to the eye department to have it seen to. They can laser them and stick them back down cleverly, clever as that may seem. They can do that, and to restore and preserve your retinal function in that area that's come away. So flashing lights, that really is a red flag for, like I said, vitreous detachment, which isn't too worrying, and it's quite common. But more importantly, retinal detachment. And then there's visual field loss for any, in even a small area or a large area, or even worse, more serious, and that's obviously retinal detachment, like I've just explained, but also it could be due to a retinal artery occlusion. So visual field loss, that's the fourth red flag, really got to be on top of and straight referring over to an ophthalmologist, eye specialist urgently. I talk about all this history and examination and red flags at length because it's important that you know it, know all about it, but also just to remind us that we've got to take all these symptoms into consideration and consider them very seriously, because these symptoms may well be completely unrelated. Like if you've had a TIA or CVA, a stroke, that may be completely unrelated to your long COVID. Or because you've had long COVID, you have long COVID, it doesn't necessarily mean we can just sort of, if you like, dismiss it or not take it seriously because you think to yourself, well, as part of my long COVID, I don't really have to, worry about that. No, any new symptom we must take seriously. Like I've said before in other updates and podcasts, we mustn't be COVID blind. I know that's a bit of a pun, not intended at the moment, because this is all about eye problems and long COVID, but we mustn't be COVID blind. So there's the assessment all done, and diagnosis and some guidance and some idea, and the serious cases, those red flaggers, have been sent off to the ophthalmologist. What else can be done? So if it's to do with the outer eyeball, the external surface, the conjunctiva or the cornea, or the lid margin, that may well be able to be dealt with by your family doctor, your GP. So conjunctivitis or uveitis, maybe, all you need is some topical antibiotics, some chloramphenicol eye ointment applied to the eye along the eye margin, just to deal with that bacterial infection. Could be a viral infection, but it may well be a bacterial infection for which you need an antibiotic ointment. I talked about itchiness of the eyeball itself or eyelid, the eye margin. Could well be due to mast cell activation. So you need treatment for mast cell activation. So those mast cells are degranulating and releasing histamine and causing all that itchiness, as in hay fever. So Opticrom eye drops, so sodium chromoglycate eye drops, which you can get in the chemist over the counter. You don't need a prescription for this. Calm the itchiness down really superbly. Got to apply it 4 times a day, but if you do that, get into the swing of that, that will dampen down that itchiness and take it away. You may need, if you've got mast cell activation, you've probably got the other elements of mast cell activation. And so you may well be needing to have an H1 and H2 blocker as well. So an antihistamine or an anti-acid medication for that as well. But if it's really just the eyes that are troubling you, sodium chromoglycate Opticrom eye drops, really excellent at dampening down that itchiness. If you're complaining of you're experiencing eye grittiness, it may well all just be due to a dry eye syndrome, which again is very common. It's commoner in long COVID because the lacrimal gland, the tear gland, is not working so well, or the duct leading from the gland to the eyeball itself may be blocked or semi-blocked. So therefore, your eyes are feeling dry, and there is that sort of grittiness. And so your GP, your family practitioner may prescribe you preservative-free eye drops, eye lubricants, just to keep the eye moist. Applied 4 times a day, just can ease that grittiness that you can get with dry eye syndrome. If you've got problems with focusing, obviously, obviously the doctor has checked your visual acuity using the eye chart. You probably need to go off to the optician just to have it done a bit more technically, to see whether you are indeed long or short sighted, in need of glasses for whatever reason. I talked about fatigue and fog as being causes for these visual symptoms. And so obviously fatigue, fog, what are we immediately thinking? We're thinking of pacing, aren't we? We're thinking of the 3 Ps. Yes, go back to the update on fatigue. So pacing, and they talk about the 20-20-20 rule. So every 20 minutes, if you're concentrating on something or looking and reading something or working at the screen or whatever, every 20 minutes you sort of like have a break and change your sort of visual gaze and look at something in the distance, more than 20 feet away, for 20 seconds. So in a way, you're sort of, if you like, resting your eye and sort of not getting that fixed on that distance between you and your book or you and your screen. So in a way, you're pacing yourself every 20 minutes. You're having a little mini break, if you like. Whilst we're talking about screens, obviously a bright screen is going to be if you're feeling a bit of photosensitivity, then, by dimming it down a bit will help you. It's common sense, really. And some people find relief by using blue light filtering glasses or tinted lenses. So those are things you can do. But if your visual eye problems are due to problems with the retina or the optic nerve or the visual cortex, where eye impulses are processed in the back of the brain, that's because of what the COVID, the acute COVID, now long COVID, has done to you, and that is those excessive cytokines in the inflammatory response, or the microthrombi, or the excessive sort of immune reactivation. These are all sort of part of the long COVID, and which we know there are no real specific treatments for this. And in a way, it really usually comes down to waiting for everything to calm down, inflammation to calm down. You're waiting for natural healing, that settling of that inflammation. And if it's to do with mini clots, microthrombi, those blood vessels that they have blocked off need to be bypassed with new blood vessels being created, a process known as neovascularization. And that, it's clever. The body's clever. If there's a blockage in that blood vessel, then the body can create new blood vessels around that blockage. Likewise, the nerve. If the nerve's damaged because of the inflammatory processes, or because the blood vessels serving that nerve has been blocked off, then those damaged or killed off nerves need to be bypassed also. So new fibers are created through the process, what we know and what we call neuroplasticity, and those new connections are created. And so, if you like, the nerve fiber that's been damaged and scarred is then, if you like, bypassed, and new connections are made in order to send nerve impulses from the eye back to the visual cortex at the back of the head. But, as we all know, this takes time, and it takes time to restore and recover that normal function. That's long COVID for you. So there we are. That sort of brings me to the end of my presentation and talk here, my posting. And so really, let's just quickly skip through and bring it all together and make a summary. So, like I said at the start, eye problems, they're quite uncommon, thankfully. in long COVID, but they're there. They're part of that long list of that 204 or 206 symptoms of long COVID. They're not that common, but if you've got them and it's just another symptom of long COVID, it's just another nuisance factor for you to be having to put up with your long COVID. As I said, it may be part of your long COVID fatigue and brain fog because of those muscles, fatigue, because of the brain fog, because of strain of having to concentrate and, keep attention, etc. May be part of that. So think about how we're managing long COVID fatigue, how we're managing long COVID brain fog. It may be due to an external problem with the eyeball itself. So the commonest is dry eye syndrome. But remember, it could be part of this MCAS, mast cell activation. The problem may be due to eye muscles themselves. Again, like I said earlier, just a minute ago, the fatigue and fog problem. Or it may be due to dysautonomia, part of that whole dysautonomic process, which, again, we're all very familiar with as a common factor in so many of the long COVID patients. Then it may be due to damage of the nerves themselves, from the optic nerve right through to the back of the brain, or maybe part of the visual cortex that's been damaged. So lots of causes. So whatever the cause, remember, new problem, new symptom, go to your doctor. We need that diagnosis. We need guidance. We need, maybe it's simple and doctor can give you some treatment. Maybe the doctor say, don't like this, can't explain it, off to a specialist, an ophthalmologist. And then, the specialist can help with that diagnosis and also give us an idea as to, what to expect and how long it's going to take. An explanation is always helpful, or essential rather. But as we know, it's the commonest causes is as a result of the initial SARS-CoV-2 COVID infection that's caused some damage, that excessive inflammatory response, that dysfunction of the immune system, that immune response, dysautonomia. And sadly, like I've said earlier, there's no real treatment for those. It just takes time and, time and acceptance of what's happened has happened. But, recovery occurs through natural healing, aided by sort of lifestyle measures. And I talk about this in other presentations, those 5 elements. So focusing on nutrition, on sleep, on, and movement and de-stressing and social connection, those 5 elements I talk about. So there it is. That's my update on eye problems in long COVID. I hope you found it helpful. As I said at the start, this is an educational series for you long COVID sufferers. But remember my usual disclaimer, any advice or treatments that I've mentioned, please discuss with your doctor. So remember, safety first. So I hope that's been helpful. And obviously, if it has, share that with anyone you know who has long COVID. Let's get the word out there. A lot of the services are being withdrawn for you long COVID patients. And so you're left to sort of find your own way now. So this educational resource, I'm hoping, is bringing you some answers and to the causes and how to deal with them. So like I said at the start, thanks for the feedback. Apologies for no replies. I just haven't got the time. They're appreciated though, because it helps me with future posts. In the meantime, I wish you well with your long COVID recovery. So, all the very best to you. Cheerio then. Goodbye.